Hi class. This is our last pre-recorded video lecture for STS 1451 because all that remains is for us to have our discussions about COVID-19 and your final exam. I'm just giving you a really short lecture here to help guide you into the difficult topic that we're discussing today, end-of-life care. Our keywords are end-of-life care, hospice, palliative care, and all of those above terms can be found in the reading. Approaching the end of life is an inevitable part of medicine and human life, but we can treat it dismissively because it's an eventuality that's really difficult to confront emotionally. In a biomedical model, we can keep trying to fight disease at all costs. To paraphrase Atul Gawande, there's almost always something else a doctor can do. But do we really want to focus on fighting disease rather than treating the patient when it comes to the end of life? Gawande makes the case for palliative care, or a care that prioritizes patient comfort. That's the philosophy behind hospice, a service available for people at the end of their life. And my mother-in-law just died in a hospice facility in Ithaca only a few months ago, so it's something that feels really close to my family right now. Our medical system is so oriented around fighting disease that it can seem to some family members like giving up if you approach treatment from a palliative model. But Gawande dispels the myth that people in palliative care die more quickly. They actually survive just as long as people who pursue what we might call, looking back on history, heroic interventionist approaches, but they're more comfortable because they're able to take more painkillers and get more rest and not go back to the hospital. In addition to our reading from Gawande, I've attached an issue guide on end-of-life care. These guides are usually used to facilitate discussions in person, but that kind of discussion seems pretty unmanageable for an online class. So instead of discussing them, which really can be fun, and I encourage you to do with your friends and family if you want to, I invite you to just reflect on your own. Note that each option has pros and cons that are listed, and there are probably pros and cons you can think of on top of those. They don't map easily onto any political binary, so there's nothing here that you'd say, this is what a Republican would think, this is what a Democrat would think, this is left wing, this is right wing. It's really just different approaches, and all of them have limitations, and all of them have reasons why you might see them as beneficial. I ask you to read each option and reflect on it. You may find elements of all three that you agree with and elements of all three that you don't. The point is not to argue for which option you choose, but to use the issue guide as a way to tease out some of the ethical questions surrounding the end-of-life care. So I don't want your reflection to say, I think option one is the best and here's why. I just want to see you thinking through why this is a difficult problem. You don't have to actually propose a solution, but you can if you feel strongly about it. Next time, we're going to be discussing readings about COVID-19 based on the topics you choose. We're really getting to the finish line here, and I'm so proud of all that you've done. Thank you for watching this last lecture, and I look forward to reading more from you soon.